You are watching the DocTalk show.
So, welcome back. We are discussing fibroids with our guest speakers today in studio, Dr. Mugisha and Dr. Musinguzi. They're helping us understand this disorder, which is so common in women, tends to cause so many problems, and yet people may not really understand exactly how to treat and how to prevent it. As you said, many women may not be aware that they have these fibroids. Some eventually become pregnant. Do these fibroids affect pregnancy in any way? Dr. Daisy.
Yes, fibroids tend to affect, especially the big fibroids. Okay.
The big ones.
Yes. There are two directions fibroids go during pregnancy. One is they could undergo degeneration, so they can become smaller. Okay. But in some cases, these fibroids might be too big and not allow enough space for the pregnancy to continue to develop, and so most of these women can end up with things like miscarriages or preterm deliveries, that is having a baby before
the date.
Yes.
Okay, and that's because the big fibroid takes a lot of space in the uterine,
it can take
the wall of the womb, so
it doesn't allow for space for the pregnancy.
Doesn't allow space for the pregnancy, so it can also cause miscarriages or abortions, as well as
preterm births.
As well as preterm births. Could it also be a cause for, we see some ladies get bleeding in pregnancy? Do you think that's another?
Yes, it can cause some bleeding in pregnancy.
It can cause it?
It can.
All right. So Dr. Mugisha, we've understood some of the signs and symptoms, but what could go wrong if someone has fibroids and they are not managed appropriately? Could some things go wrong?
That's with complications. But
yes,
I would like to, it is prudent that we know that their occurrence does not really impede a lot as well. Someone can have a normal pregnancy, carry on, deliver well, even with the fibroids. Many of the women with fibroids not only do not know, but even when they know, apart from causing a lot of anxiety, they can actually live okay with them and go on with their normal reproductive roles in society. So we don't have to be so aggressive with that. Complication-wise, as you ask, it will affect your quality of life in the sense that, yes, it has a psychosocial basis. People feel stigmatized. They cannot really, and many of our clients have infertility issues. So you find that they have lost recurrent pregnancies. They are failing to conceive, and they are usually stigmatized by that. Others tend to bleed so much, even when they come in for the surgeries and many medical interventions, they are not so curatives in many cases. And so it has that psychosocial bearing on these women. And they're usually depressed.
Stigma and depression.
And they're usually depressed a lot.
Okay.
So then the anemia we had looked at, with them being chronically weak and a bit, don't have that energy, the drive to do a lot of day-to-day activities.
So just to take you a bit slow, so you mentioned the anemia is low blood in the body due to the persistent bleeding. You mentioned infertility issues, to mean that they will try to have children but they won't. I'm not sure why exactly that would happen. Or is it because it will cause miscarriages because the things are so big?
Yes, I know we are giving you a lot of conspiracy. We also do not know why specifically presence of abortions, presence of fibroids alone might also impede fertility, impede conception. But of course, we think it is going to affect the uterus itself. The blood supply to the uterus is distorted. And so the uterus.
So there's so many factors. It makes the uterus, the womb, kind of hostile to the unfavorable for the pregnancy. Okay, so it also causes the bleeding tendencies to. Would there be complications of the surgery?
Well, every surgery has complications.
Every surgery,
yes,
in its treatment.
Has complications.
So the complications come from the disease itself and from the treatments that are available. Okay, so but you're trying to emphasize that much as it's a very common problem, women can still go on to have children, yes? they can still have the desired number of children. In fact, having children tends to be protective. Okay, so we are just making people aware that if you get these symptoms, if you have abnormal periods, very heavy periods, or if you're experiencing abdominal pain, that's pain in the stomach, or you tend to go frequently urinate in the toilet, or you're having problems of constipation, these are just some of the signs. It doesn't mean that the fibroids are there, but these are some of the signs of fibroids. So we encourage you to go and seek care from the gynecologists. Gynecologists are doctors who specialize in women's health, just like our guest doctors here. They will help you best to help overcome this problem of fibroids. So, Dr. Daisy Masinguzi, you are going to, could you help us understand, much as it's a very common condition in women, I imagine it is a treatable condition. How exactly is it treated? This condition called fibroids.
Treatment of fibroids, first of all, depends on, one, the size of the fibroid, its location, if it's causing symptoms to this woman, what the fertility desires of this woman might be. For example, does she want to have children? Is she done having children? And then the severity of the symptoms that she has. Okay? How bad is it that these fibroids are causing? What is the effect of these fibroids on her lifestyle?
Okay. So it isn't that there's like one clear-cut solution that if you have fibroids, you need this.
No.
It depends on so many other factors.
Depends on so many other factors.
Okay. So why do you say factors such as size or severity
For example,
would dictate the treatment options?
Size, the bigger the size, the more likely she's going to have more symptoms, for example. Or if it's a woman who wants to have children, okay, you would want to consider the size. The location is very important. For example, the innermost layer of the uterus tend to affect fertility a lot. So those ones would need to be removed.
Okay. So I'm sure I know you always carefully evaluate these women before deciding the best treatment options.
Yes.
Yes. So Dr. Mugisha, which are the treatment options available for ladies who have fibroids? Where do they go and what will be done to them?
We usually request that you actually seek a gynecologist review whenever you actually have symptoms or have been incidentally found to have fibroids. For a more, we draw up a plan and know what you really require. And a lot of this treatment is patient tailored. So what do you want? What are we projecting at? And we work around that. Do we control symptoms for how long? So for better outcomes, more satisfaction to our patients, you really have to have a nice plan drafted with your doctor, a lot of personal patient-doctor relationship. So the ideal patient to manage for us on our case is one with fibroids, is either done with reproduction, has children and has no desires, as Dr. Daisy alluded to have any more children, and does not need her uterus. There's a lot of cultural attachment with uteruses. So women feel, don't touch my uterus, I'll feel less of a woman. Same thing we feel with periods. So sometimes there are women who even after delivery I have 5, 6 children, I don't need any more, but I really need to stay with my uterus. That aside, if you had a patient with fibroids who does not have any fertility desires and does not require treatment, does not require the uterus to be in, those are perfect patients because we actually do remove the whole uterus, the whole womb, a process we call hysterectomy. And that is a complete cure, and that's surgery. And that's a complete cure. However,
so you say just a minute. You said the surgery is done for women who do not desire children anymore.
That surgery in particular.
That surgery where they remove the whole uterus.
Yes.
Should only be done in women who intend not to have any more children. So the women who still want to have children, do you used to recommend that surgery?
That surgery. If it is life-threatening, we really advise it sometimes. If sometimes the bleeding is so profuse and we feel like, we need to come to a compromise, Can we have other maybe adoption and something like that? Other ways to have children and not necessarily retain this uterus.
Only in the life-threatening
if it's going to be
conditions.
life-threatening.
You are watching the DocTalk Show.